Childhood illnesses every parent should know. While vaccines have made some childhood illnesses rare, many others still remain a fact of life. They range from common infections like croup to mysterious ailments like Kawasaki disease. In the following presentation, you'll learn the facts about 24 childhood illnesses, and we recommend that you always seek medical advice for proper diagnosis and treatment. Croup. The hallmark of croup is a tight cough that sounds like a barking seal. The cause of the cough is inflammation in the upper airways, usually due to a virus. If breathing becomes severely impaired, hospital treatment may be needed. However, most kids get better on their own in about a week. Croup is most common in toddlers. Bronchiolitis, or RSV. RSV stands for Respiratory Syncytial virus. When it affects the lungs, it causes bronchiolitis. It's most common in babies under 12 months old, and often occurs most between October and March. The infection begins with flu-like symptoms, including a fever, runny nose, and cough. Some young children with their first RSV infection will develop noticeable wheezing and may need treatment in hospital. RSV tends to be milder in older children and adults. Ear infections. Young children are prone to ear infections because of their small eustachian tubes. These tubes connect the ears to the throat, and they may get blocked when a cold causes inflammation. This traps fluid inside the middle ear, behind the eardrum, allowing germs to breed. The symptoms include fever, fussiness, and ear pulling. Most ear infections are due to viruses and go away on their own. Childhood vaccinations can help prevent infections from certain bacteria that can cause ear infections. Glue ear. Glue ear refers to a buildup of fluid in the middle ear, usually without any pain. The medical term for glue ear is Otitis media with effusion, and it often follows an acute ear infection. The fluid usually clears up on its own. If it lingers and threatens to interfere with a child's hearing, grommets or ear tubes may be recommended to help the fluid drain. Hand, foot and mouth disease. Hand, foot and mouth disease causes a fever along with blisters on the inside of the mouth, the palms of the hands, the buttocks, and the soles of the feet. It's usually caused by Coxsackie A virus. Most cases are not serious and last a week to 10 days. Hand, foot and mouth disease is not the same as foot and mouth disease, which affects farm animals. Conjunctivitis. Tears, redness, discomfort, discharge, and crusty eyelashes are all signs of conjunctivitis. Often caused by the same viruses as the common cold, conjunctivitis spreads rapidly in schools and nurseries. Seek medical advice to determine whether your child needs treatment. Most cases clear up in 4 to 7 days. Slap cheek. Slap cheek syndrome, or fifth disease, causes a bright red rash on a child's face. A rash may also appear on the torso, arms, or legs. The culprit is the parvovirus B19, a virus that may cause mild cold-like symptoms before the rash is even seen. Slap cheek syndrome usually affects children aged between 3 and 15. Most cases develop during winter or early spring, and the symptoms usually disappear within a few days, but can last 4 to 5 weeks. Rotavirus. The National Health Service estimates that every child would have at least one rotavirus infection before they are 5 years old. The main symptoms are vomiting and watery diarrhea, which can make babies become dehydrated very quickly. It's more common in winter and spring. A rotavirus vaccine is currently available for babies, but is not part of the NHS childhood vaccination program. Kawasaki disease. Kawasaki disease is a very rare condition that mainly affects under 5s. Doctors have yet to discover what causes it. The symptoms include a fever, patchy rash, swelling, and redness of the hands and feet, as well as bloodshot eyes and chapped red lips. Without treatment, the illness can damage the heart and may be fatal. If you think your child has Kawasaki disease, seek urgent medical attention. Chickenpox. Chickenpox is usually a mild infection, but is a very infectious condition caused by the varicella zoster virus. Chickenpox is most common in children under 10 years old. It's most common in winter and spring, and chickenpox can cause dangerous complications in newborn babies, adults, and pregnant women. Once you've had chickenpox, it's extremely rare to catch it for a second time. A vaccine is available against chickenpox for some people in at-risk groups. Measles. If your children have had their MMR jabs, you probably don't have to worry about measles, although there are still some cases among unvaccinated children. The infection starts with a fever, runny nose, and cough. As these symptoms fade, a full body rash appears. Most children get better in 2 weeks, but some develop pneumonia or other problems. Mumps. Mumps is another childhood illness that was very common before the MMR vaccine was developed. The infection often causes no symptoms, but when it does, the classic sign is swollen glands between the ear and jaw. This creates the appearance of hamster cheeks. Despite high vaccination rates, there are still cases, usually amongst unvaccinated teenagers and young adults. Rubella, or German measles. Rubella, also called German measles, is a mild virus that usually causes no serious problems other than a fever and a rash. However, it can harm the unborn baby if a pregnant woman becomes infected. The symptoms are a low-grade fever and a rash that spreads from the face to the rest of the body. The MMR childhood vaccination protects against measles, mumps, and rubella. Whooping cough. Whooping cough, caused by infection with Bordella pertussis bacteria, makes children cough so hard they run out of breath and inhale with a hoop. The infection is most severe in infants and may require hospital treatment. The medical term for the disease is pertussis, the P in the DTaP vaccine. Meningitis. Meningitis is an inflammation or infection of the tissue around the brain and the spinal cord. In older children, teenagers, and adults, the main symptoms are severe headache, vomiting, fever, and stiff neck. Young children may have flu-like symptoms, but viral meningitis is usually mild. Bacterial meningitis is more severe, with serious consequences if it's not treated quickly. The best way to prevent meningitis is by ensuring that all vaccinations are kept up to date. Sore throat. Most children get a sore throat now and then, usually due to a common cold virus. So how can you tell if it's caused by a more serious streptococcal or other infection? Sneezing or a runny nose point to a cold. Seek medical advice if a sore throat lasts more than a week, or if there's pain or difficulty swallowing, excessive drooling, a rash, or pus in the back of the throat or fever. Scarlet fever. Sometimes a rough pink-red rash accompanies a sore or strep throat. This is known as scarlet fever. The rash usually appears 12 to 48 hours after the fever, and often begins on the chest and abdomen, and spreads all over the body. It's sometimes accompanied by a strawberry-looking tongue. Without treatment, it can lead to rheumatic fever, and in rare cases, heart damage. Scarlet fever is rare in the UK because of the use of antibiotics for strep infections. Reye's syndrome. You probably know you should never give aspirin to children under 16 years of age, except on a doctor's advice. Reye's syndrome is the reason. This life-threatening condition may affect children who take medication containing aspirin during a viral illness. Symptoms include dramatic behavioral changes, seizures, and coma. Reye's syndrome has become very rare since the aspirin health warnings were issued in the 1980s. MRSA, or MRSA. MRSA is known as a superbug because it doesn't respond to some antibiotics. MRSA can cause skin infections, such as boils and abscesses. MRSA infections usually develop in people being treated in hospital, especially intensive care units and surgical wards. Impetigo. Impetigo is another bacterial skin infection. It most commonly causes clusters of tiny blisters on the skin that ooze and form a golden crust. Touching the fluid can spread the infection to other parts of the body or other people. It's often caused by staph bacteria, but can also be caused by strep bacteria. Impetigo is most common in children because of close contact in schools and nurseries. If treated with antibiotics, the sores usually heal without leaving any scars. Ringworm. Yet another skin infection. Ringworm is actually caused by a fungus. No worms involved. It causes a red, scaly ring on the skin or a round patch of hair loss on the scalp. The fungus spreads easily from child to child, so sharing combs, brushes, towels, and clothes should be avoided. Ringworm is treated with antifungal medication. Lyme disease. The hallmark of Lyme disease is a target-shaped rash that appears around 1 to 2 weeks after a tick bite, though not everybody will develop the distinctive bullseye rash. The rash may be accompanied by a fever, chills, and body aches. Lyme disease is not common. There are around 1 to 2,000 cases of Lyme disease in the UK each year, with the infected ticks commonly found in woodland and heartland areas. Without treatment, Lyme disease can affect the joints, nervous system, and heart. Flu, or influenza. Is it a cold or is it flu? These illnesses can have similar symptoms. The flu more commonly causes high fever, chills, body aches, extreme fatigue, nausea, or vomiting. Whilst most children get better on their own, the flu can lead to serious complications like pneumonia, especially in younger children. Flu jabs are currently only recommended for children in at-risk groups. Seasonal allergies. Seasonal allergies, like hay fever, are not an infection, but a reaction to microscopic particles like pollen, seen here in pink. Symptoms may include sneezing, watery eyes, and a runny or stuffy nose, and may only occur in spring or autumn. There is no cure for hay fever, but there are ways to help control the symptoms. This presentation was brought to you by the Parenting Advice channel and in association with Peapod Parenting. For more videos on parenting advice, please don't forget to subscribe to this channel on YouTube. And for more information about the services that Peapod Parenting provide, please visit their website at www.peapodparenting.co.uk. Thanks for watching.